Hello everyone, Dr. Sam Schroetke here, Physical Therapy and Hand Clinic of Hillsboro with Technique Tuesday, and kind of rounding out our series of videos here for people who are having hip pain, so it's pain in the front, or sacroiliac joint pain. As I said in previous videos, if it's coming from here, you might either check with your physical therapist first or try one of the exercises for your lumbar spine, your low back, to see if it doesn't help get rid of that, because that's often stemming from the low back, but it could be hip. All right, so I've been doing repeated hip extension. This is continuing on that theme. This one, if you were doing these previous exercises and getting some relief, or no relief actually, but they weren't making you worse, then you might have to try this progression. I find that this one might work better for athletes. So if we have patients who are doing a lot of deep squatting or a lot of work where they have to really get into their hips, CrossFit athletes often have this, power lifters. If these athletes might respond more to this force alternative. So in previous video, we've been doing repeated hip extension with that overpressure in the backhand, 10 to 15 reps. I did another video where you sustain a hold for 15 to 30 seconds. If those weren't quite getting at it, then let's try this one. This one is hip extension in half kneeling, but it's ballistic. Okay, so it's kind of explosive, like a plyometric. Again, your supported surface is on your opposite side. So my painful side we're saying is my right, so the right knee is down. Again, that front foot has to be kicked out quite far because we need to get to end range. So this is ballistic. So you're going to be bouncing in and out of it almost. So you're here and you extend, just like that. That works. This is going to work for some people. Pressure on, pressure off. The more athletic types, if you find that if you're doing some heavier deep squatting, and you're having that hip pain when you're in that down position or when you're done, and you've done the other exercise I've showed you, then you might give this one a whirl if those weren't working for you. Okay, so ballistic hip extension and half kneeling. I'll do it one more time. So hands here. I'm just saying a little bit of overpressure here. So we're going to into the hip extension and then pop it at the end, kind of. Okay, just like that. Ballistic hip extension, half kneeling. 10 to 15 reps every 3 to 4 hours. And I would say if you're an athlete and you're getting your pain either during or after your sport, then you might do this both before and after, maybe even during, just to help mitigate those symptoms. So repeated hip extension, ballistic hip extension and half kneeling for hip pain, sacroiliac joint pain. If it makes your symptoms worse, red light, don't do it. If it's making them better, then by all means go for it, okay? Like the video, like us on Facebook, leave comments below, ask questions, we'll get back to you. Check with your physical therapist or physician before doing any of these exercises. Make sure they're appropriate for you. They're not appropriate for everyone. All right, Dr. Sam Schroetke here, Physical Therapy and Hand Clinic of Hillsboro with Technique Tuesday.